Our next speaker is going to be Dr. Srinivas Kumar. He is a chief cardiologist of Continental Hospitals. He is going to speak on adherence to cardiovascular therapy, evidence for action. Dr. Srinivas Kumar.
Yeah, good evening to all of you. As we are running behind schedule, I thought we could avoid one or two talks. I was thinking probably from the organization we could skip, but I couldn't avoid skipping this talk because if you have to mention to all of you that for me to become cardiologist, apart from my parents who gave birth to me, and then Professor Krishnaraju was one who inspired us to become cardiologist. That's how we are here now. And for this meeting, Advanced Cardiovascular Solutions in India, to become popular and to take it to each and every cardiologist across the country, Reddy Laboratories played a significant role in getting this conference to this level. I'm very thankful to all the Reddy staff. So they requested me to give a talk on this adherence to cardiovascular therapy, evidence for action. I'm very touchy about this, and I'm relatively sorry to bother you with too much of theoretical talk, but at the same time I will try to see how some of the astonishing facts on the drug adherence and how it is important. This is important not only for interventional cardiologist, any clinical cardiologist or physician, or for that matter any practitioner, and for any patient. It is very surprising to note some of the facts that how drug compliance and adherence plays an important role, and we will see how best to avoid such problems in future. This slide brings you best wishes from Continental Hospital, where Dr. Krishnaraju just mentioned, joined. This is another important aspect in my life, the FACTS Foundation, what we are developing in partnership with Cardiovascular Research Foundation. We have established a training facility in this place. This is in Banjara Hills. Yesterday we conducted IVAS workshop. We have facilities for cath lab and intravascular ultrasound. We're trying to develop this with a non-profit motive to train a lot of younger cardiologists. Then in coming 10-15 minutes, what I would do is basically to assess how much is the prevalence of medication non-adherence, what percentage of patients do not take medicines properly, and what are the problems, why are we so much bothered about when the patient is taking medicine or not, why should we be so much bothered. We'll try to show some of this data to show that how non-compliance of medicine leads to so much of problem to patient. And finally, it's not just enough to know what are the problems we get, but we should also find some solutions, how to avoid such problems in these patients, and what are the interventions which we have now to improve this medication adherence, and thereby patients should be behaving better. To take you through a day-to-day story which we come across in any clinical practice, it is written as LS, it could be anybody. A 58-year-old chronic hypertensive, diabetic, hyperlipidemic comes on follow-up. Then she complains of some new complaint like joint pain or some eye sty, or it can be any other complaint. And when you check her sugars, they are not controlled. When you check her blood pressure, it's not controlled. And then the cholesterols are also not very well controlled. This is not uncommon situation in day-to-day practice. If you see what is the reason behind it, if you try to analyze more closely, then she takes, when you, after thinking various things, when you ask about the medicines, she says sometimes she forgets to take medicines. She takes medicines irregularly, or she takes some as and when, in between she keeps forgetting. Obviously sugars, pressures cannot be controlled. Then what is the next thing we do? Immediately, if you're not careful to check with the patient because of busy schedule of our practice, or because in a hurry to see more patients and required specified time we have, then probably keep on increasing the dosage of medication. So which may not be right thing always to do, but sometimes this study shows that even increasing the medication dose could avoid and do produce some benefits. But is the right thing to do? That is what is we need to see. Then a word about what is compliance and what is adherence. Some of these look very theoretical, but we'll ponder over it just to have some more information. Compliance is when you advise something to the patient, whether he is taking it regularly or not. That is the extent to which a person's behavior coincides with medical or health advice. You asked him to take twice daily a tablet, whether he is regularly following it or not. Then adherence is another term which is used basically to know the extent of which person's behavior taking medicine. Like patient does take medicines and follow the lifestyle regularly, but the response which that patient is getting may not be adequately same as what is known or described in the literature. Then some of the rule of 6 which are mentioned here look quite interesting, that's how we included in it. Not that all patients are bad, we do have some sincere patients. About 1/6 of the patients are supposed to be taking the medication regularly, and they're very strict and punctual, put times and then take medications very well on time. About 1/6 of the patients actually prescribed doses, they take medicines but with some change in timings, 1 or 2 hours that side, this side. And another 1/6 occasionally omit a single day's dose with again fluctuation in dose timings. And some more worse patients, they take some drug holidays, they do not take medication for about 3 to 4 times in a year for some period of time. And then some people who are more worse, every month they miss medication. So these are some of the various types of patients which we come across. Obviously the more worse is the lower one, the best is the top one. When you see, when compared to standard prescription which is written, 100% when it is prescribed, in the continuation long-term phase, only about 50% of them take the medications on time. If you see in acute MI scenario, which is supposed to be shocking for the family and the patient, even in this type of scenario, you find significant dropouts in taking medication. 1/4 of the patients, again, even at day 7, miss out some of the medications which are given to these patients. So then if you see the chronic heart failure, what was discussed upon, if you see, then the incidence of taking of this medication, actually I was very encouraged to note that the patients are taking statins in a little higher level than beta blockers and spironolactone, but we have various other studies showing that even patients, only 1/3 of them are being kept on statin. Then in post-MI situations, why are we so much bothered? It is very surprising to note that if patients stop this medication, then 80% of higher chance of dying within 1 year compared to patients who take medicines regularly. It's such a high incidence. Then if some patients have a like 44% high chance of dying within 1 year if the patients take medicines occasionally regularly compared to a person who is totally stopped. Even in stable CAD patients, that was in acute scenario, obviously the death rates and problems are very high if they don't take medication. But even in stable coronary artery disease, their patients compared to patients who take medication regularly versus to those patients who do not take, there are 4-fold increase in incidence of stroke and about roughly about 3.8, again 4-fold increase of death. This is surprisingly very high figures which I also came across. Then same is the case even with multiple other drugs, beta blockers, statins and ACE inhibitors. I should say that beta blockers again are good drugs when the patient is taking the medication correctly, but they have this rebound tendency of blood pressure rise, heart rate rise when the patients take it regularly, and that could lead into trouble. So suddenly blood pressures rise and we do see patients landing with stroke and other problems. So one more interesting data, which is again anything related to finances, anything related to cost effectiveness is highlighted very much more in the cost conscious era of today. If you see it carefully analyzed, not only it saves lives, but it produces a lot of benefit financially to patient as well as the healthcare industry. If you see a patient who is taking medication regularly, the hospitalization risk is very less, 13% compared to those who do not take. That is again 3-fold rise. Similarly, all the patients hypertension, hypercholesterolemia and heart failure incidents, again as mentioned, if they don't take medication, they get admitted more faster, leading to more expenses to family and draining out. So total costs lower by 47% if the patients adhere to these drugs properly. So now we know that the patient who is taking medication regularly has less chance of getting into trouble, and he also has less chance of spending more money just by adhering to strict medication properly. So is it good enough to tell patients that you should take regularly, or what shall we do to improve this compliance and adherence? Then it is time for us to think some of these newer options and to do what is good. When they try to analyze why patients do not take, or what are the reasons, because you can come out of conclusions and what to do only if you analyze why it is happening for general. So they came to see the top 5 reasons. Obviously in our country, probably is more pertinent to our Indian subcontinent, is the cost. where patients need to buy these medications themselves, and the cost of the medicines, obviously we can understand some of the poor patients taking. But it's not only the question of that. Even the patients who can afford financially also have various strange reasons that they think they could develop side effects. They also think that it is not good to take these medications longer. And if you analyze some funny reasons, we could have this lot of psychosocial complex health behaviors are involved. The patient says he feels like he is continuously feels like patient if he takes. WHO also studied to analyze what are the reasons for non-adherence of patients. Again, some of the things which are already described or mentioned here. Apart from the high cost, it is very important then how to improve the patient adherence. The ideal time to improve the patient adherence is to talk to the patient and impress upon him in the acute stage when he gets into the problem. Probably the receptiveness is more. Then the provider strategy for all us to remember, just they coined it a mnemonic as simplify regime. You try to give the medication in a simple way. That's how the compliance of a single long-acting drugs are found to be more better than the drugs which are to be taken thrice daily, quarterly, 4 times a day, because again the compliance matters. That's how now we have more longer acting drugs, not only for the benefit of having better benefits, but also patients' compliance improves when you take a simple regime. And we need to impart knowledge to these patients and modify patients' beliefs and human behavior, and provide communication and trust to the patient, leave the bias, and we need to check whether the patient is taking, evaluate the adherence. That's what it's mean. Then how to simplify regime. And one of the most, various companies think of various other alternatives. I think Reddy's has come out with the concept of active packing, where instead of having separate pills being purchased separately, what they have analyzed and noted is many patients do purchase medicines for only 5 days and 10 days. Probably if you offer this in a package, active packed mechanisms, probably the drugs are available for more longer. That itself could avoid taking the medications, missing out medications, frequency of missing definitely slightly less compared to those. This is what is shown in this cartoon. Then another important aspect about not only making medicines in a compliant pack, a long-acting pack, but it's also important to discuss with the patient and impart them knowledge how important it is to take medicine and how bad it could produce into trouble when the patients do not take medicines on time. Then you also need to impress upon these patients that patients are our priority, and whatever we are doing is for good of the patients, and counsel them properly and remove their fears and concerns and regarding the problems which could happen to the patient. Then communication style is one of the strong predictors of patient trust. As we mentioned, Dr. Somraj was mentioning in the morning, as in with changing practice scenarios where we spend less time with the patient, and the trust factor is becoming deficit in the patient. So very important to talk to the patient effectively and take him into confidence, and you establish proper rapport and adhere and think what are his problems. It is said that many of the times we do not understand the patient's problem really, or half of the patients do not communicate their problems to doctors themselves correctly. So probably if you establish a good rapport with the patient, bring them into confidence, and a lot of problems of adherence also could come down. And 71% of the malpractice suits which are come basically can go away if you can build up the trust and confidence of this patient. That's what is mentioned. And then if you have effective communication skills and you have some other materials which you can give for patient to adhere to this, then probably this could be encouraged. Then the lower health literacy and again lack of knowledge is something again bothersome for our country, because some of our patients are illiterates and cannot understand. But even those patients, probably if you take a little more time and explain to them, probably it will help them in adherence and following this, taking these medications regularly. Then changing my practice to collect and value adherence info. This some of the steps which are mentioned is how to call the patients to come regularly, and some of the things like teamwork. Like if doctors are busy, if we are busy, we could also organize some team of nurses. Now physician health assistants do quite a good job for us in the hospital, and then similarly you could take the help of technology like telephone and emails for pharmacy delivery systems. And now you have in facilities like Continental or some of the newer setups which are coming up where electronic medical records are being practiced. Then once the medication filling is over, the alert goes to the patient, and then patient is reminded that he needs to come back. And then there are systems, the delivery of medication also which are being followed, but it's not easy to follow that type of systems in our patient where we need to go a long way. Then there are also now SMSs which are developed that if patient misses a particular dose of tablet, if it is remaining in the adherence pack, the patient and the doctor do get some SMS messages when the patient doesn't adhere to his treatment. Then primary care providers can improve outcome by focusing on drug policies and then also spending more time with patients. And some of these newer formulations like active packs which could bring more adherence to the patients could go a long way in patients, improving the patient's outcomes. As it is well said by Coop, it is said that drugs do not work in patients who don't take them. Obviously, you need to be taking these medications so as to get the benefit. Thank you very much for your patient hearing. That reminds me of one of our Bhimavaram patients when the doctor told that they need to exercise. Rajgopal sir told this. Then they said a patient had admitted with DVT. Then doctor told him to do regular exercises. So he is very hefty and generally they are very well to do. And then they keep one person besides them. So he said, and Dr. Raju told him that you better move your limb regularly and exercise. That fellow shouts on his attendant, "Hey, what are you doing, man? What, you're not listening what doctor is telling you, please do that also for me." So that is some of the things which the patients think that with anything in life, if you don't want to put in effort and you want to get in the benefits, I don't think that is the right way for anybody to think and practice in life. I think with this I end. Thank you very much for this opportunity. Thank you.
I think to make the patients take their medicine, the fundamental formula is keep it simple, low cost, only essential drugs where they take large number of drugs and understandable, and use the wife effectively. Wife can be a very effective nurse at home, and now you have electronic pill boxes which will remind you.
Yeah, that's
In
what.
fact, the other day I bought one.
That SMS thing is for the electronic pill boxes.
Yeah, electronic.
One more other thing I feel which is not mentioned here is multiple drugs which can be pharmacokinetically clubbed. Like we do have combination drugs coming, like a polypill like concept. Probably for chronic diseases it could be better. But the problem with that polypill concept is you may not be able to give the right dose of each of these in the regular